So yeah, what we're going to talk about is a little bit of the high level of research and some of the uh, information and science that we've gathered over the last 20, 30 years. When we talked about cannabinoids being neuroprotectant antioxidants, really what we're talking about is balancing the brain chemistry, glutamate, slowing that down a little bit and inhibiting some of the excitotoxicity. Canakeys is one of the chief places where we go for all of our research and literature. And Canakeys does something that is key for everybody else. So for instance, we can go to PubMed. PubMed is the repository of all of the scientific and clinical studies and all of the research that we are gathering across the world. And Canakeys takes that, breaks it down, and funnels it into the way that we can interpret these studies as lay people and clinicians. So what's clinical, what's preclinical, which is labs and animal studies with rodents generally, and then what is just cell cultures and that sort of thing. We're moving way past the cell cultures and the animal studies with respect to cannabinoids, but because they are Schedule 1, which we talked about is no medical benefits, highly addictive and dangerous, which is crazy. Cannabis needs to be descheduled, which we all know. Then we'll be able to study it more. But the studies are showing a vast response. We're seeing studies in the 70s, 80s, 90s with a clinical effect in using this with people. The studies are generally small, but what they're finding is this is working incredibly. And so when we go back up to the animal studies, the cannabinoids are modulating processing of the brain proteins. So they're seeing when they give cannabinoids, with the cannabinoids that are already in the mice, they're giving them diseases and then seeing what the physiological response is. And that's how we figure things out. Animal studies don't always translate to humans, but generally they do. And we're finding that the same thing is happening in humans. We're seeing reduced proteins, and they're seeing a lot of this in autopsies, but we're getting closer to the science and imaging to see this in real life. Reducing the inflammation and the excitotoxicity. This is that balancing of the ROS, the oxidation in our brain, and again, the excitotoxicity, making sure that the brain is balanced. And it does this with the interactive signaling between CB1, CB2. Protecting against neuroinflammation. We'll talk about CB2 in a moment, but it helps supports the brain intrinsic repair mechanism. So think about a cleaning crew that comes in at night when the office building is quiet. That's sort of what CB2 activation is. And all of those microglia are now cleaning up the brain, especially while we sleep. And that is pruning the bad stuff and enhancing the good stuff, and then neurogenesis, stimulating new brain cells, which we know still happens even up until we die. It improves blood flow in the brain. And helping get that oxygenated, rich blood flow into the hippocampus, strengthening memory and processing, as well as just enhancing blood flow. And then it doesn't worsen the Alzheimer's pathologies. A lot of times when we're looking at something that we're going to introduce as a substance for humans, we want to know, is it safe? Is it effective? And is it going to make this worse? And the answer is no. None of these cannabinoids worsen any of the Alzheimer's pathologies, which gives us that safe nudge to be able to explore. And chemotype 2 and 3 is what we really want to be working with. On these animal studies, we're seeing that CB2 receptor activation is helping with all of these things that we've just discussed, but it is reducing the memory impairment, reducing the infarct size. So if we have a stroke, it'll help to trim that down and then repair the brain after that. Like as we found out 20 years ago, cannabinoids as neuroprotectant antioxidants able to repair brain from injury, stroke, and illness, neurodegenerative illness. And then if we go down to the clinical data from 2006, they administered dronabinol, which is a synthetic version of THC, also known as Marinol, 2.5 milligrams. So we talked about that 2 milligrams. That's underneath the psychoactive threshold for psychoactive effects. And so that's a safe dose to give somebody. We're not going to do anything to trigger impairment, but we're going to get the benefits of using THC in that low dose. And what did they find? They found that it dramatically reduced nocturnal motor activity and agitation. So people got in bed, they stayed in bed, they slept, they weren't agitated, they weren't getting up. This can improve sleep, improve their pain, improve well-being, reduce caregiver demand, and make it less of a burden. So what the question is, why are we not experimenting with this in assisted living and nursing homes today? We have dronabinol available. Everybody could prescribe it on the clinical basis, and it really is just stigma. They don't know. They're using antipsychotics and benzodiazepines, which we know are more harmful to seniors. So I implore all clinicians to give it a try. And then just looking at the endocannabinoid system, it modulates every pathological process in the brain during all phases. So in early phases, the receptors are increasing, and we see that what's happening is the receptors are signaling that there is distress in the tissues, looking for the endocannabinoids. But the endocannabinoids are not being created. They're not synthesized from the lipids and the fatty acids that we should be eating in a good diet. It's just not being made. And so this is why when we supplement with phytocannabinoids, we can bring that up and repair some of this. But as the receptors are sitting there without activation, they start declining. And so when we look at autopsies, there's very little CB1 and CB2 receptors left in these cell membranes because they've given up. And what we want to do is, as we're working with these patients, is continue the full spectrum supplements to inspire the cleanup and the CB1 connections in the hippocampus, re-stimulating memory and doing that sort of thing. THC is an acetylcholinesterase inhibitor, and that's an enzyme that breaks down acetylcholine. When we have acetylcholine in our brain, we are making and preserving memories. Our hippocampal regions are functioning optimally. When we're not making them, they're not. And what we're finding is that these drugs, my mother was on all of them, galantamine, donepezil, etc. Memantine is the drug brand name, but all of these are short-lived. So what that means is they work for 3 to 6 months, and then the efficacy dwindles and they stop being effective. But these patients stay on them for years, but that may be toxic. And what we're finding is that the cannabinoids can do a lot of the same functions, and they're promising and benign. They're not causing the side effects, and they are able to be given without toxicity and may slow progression. So we should be using these in our elders. And Stacy Gruber runs the mind studies over at the McLean Hospital at Harvard. And she is doing some older adult studies where they're doing imaging and that sort of thing with people that are using cannabinoids from the open market. And they're observing them and how they're working. And what they're finding is after 3 months of medical marijuana supplements, people are getting these brain scans with higher activity in the cingulate cortex, which is the activity, the area involved with paying attention, distractions, and problem solving. And the neuroimaging is revealing normalization of these brain tissues as the cognitive skills improve. And they're asking the question, is it because people feel less pain, they're sleeping better, or they're using fewer medications like opiates and benzodiazepines that cause impairment in thinking, memories, falls, and that sort of thing? Or is it a direct effect from the cannabis? So we don't know yet. We need to get deeper into the studies, but we're researching this. And the other thing is that we're drawing more correlations. One of the greatest ones that they found recently was how pain really seems to bring on Alzheimer's, just like high blood sugar levels is bringing on Alzheimer's, and metabolic issues. Pain might be causing that. And the more pain sites that people have around their body, the more that this might be happening. And it's, as you can see, is causing memory loss and hippocampal shrinkage. And that can worsen behaviors. And a lot of times, think about folks that are struggling with dementias, they're not able to communicate. If they can't tell you that they're in pain, we have untreated pain, which is going to cause more behaviors because they're uncomfortable. And so we treat the pain with cannabinoids. We're also treating everything else, the neuroinflammation, antioxidants, and we're helping them move towards better quality of life, reduce symptoms, decreased risk, increasing mobility.